It is the 13th of June, this 2016. I am Ralph Turchiano. We're here to cover with you the top 3 health headlines of the past 7 days. Starting off with number 1, Pharma Firms may have got caught manipulating data resulting in agony and profit. The actual title to the courthouse documents was Firms reached $67 million deal with the feds, which was actually like a slap on the wrist. You'll understand more in a second. This is in regard to a chemo drug called Tarceva. What Genentech basically did, according to court documents, was exaggerate the benefits of this chemo drug to populations which should not have been using this drug to begin with. To quote the documents, it says as follows: misleading marketing caused some lung cancer patients to die earlier and faster and, tragically, with more pain. I added the tragically. As a result of the exaggerated marketing to doctors, Genentech and OSI knowingly caused false or fraudulent claims to be submitted to Medicare and other federal and state health care programs for purchases of Tarceva. The company said in its defense, which was kind of equally as disturbing as the deception to begin with, is as follows, because it sounds kind of psychopathic. We believe our Tarceva promotional communications and practices were and are entirely proper in compliance with the law. Doesn't mean it's right, this means it's with the law. Genentech spokesman said, this settlement, however, allows the company to avoid the burden, disruption, cost, and distraction of protracted civil litigation and to focus instead on our business developing medicines that extend and improve human lives. Yeah, I'm going to leave it at that. Number 2. All right, the Lancet. This is from the Lancet, so please don't debate me in regard to the benefit of antidepressants. This is from the Lancet. The Lancet, most antidepressant drugs are ineffective for children and teens according to study. To quote the study, most available antidepressants are ineffective, and some may be unsafe for children and teenagers with major depression, according to the most comprehensive comparison of commonly prescribed antidepressant drugs so far published in the Lancet. The findings indicate that of the 14 antidepressants, only 1 performed as well, if not better than a placebo, at relieving the symptoms of depression. Now, regard the side effects to see if these drugs are doing more harm than good. This is where it gets a little cloudy. However, the true effectiveness and risks of serious harm, such as suicidal thoughts and attempts, remain unclear because of the small number and poor design of clinical trials assessing these antidepressants. So, buyer beware. Number 3, many with migraines have vitamin deficiencies, says study. Well, it sounds kind of obvious, but however, though, there's certain deficiencies which kind of caught me off guard too. A high percentage of children, teens, and young adults with migraines appear to have mild deficiencies in vitamin D, riboflavin, and coenzyme Q10. A vitamin-like substance found in every cell of the body that is used to produce energy for cell growth and maintenance. It's kind of unusual because this is as the children are growing, you expect CoQ10 levels to be okay, but they were not. They found that girls and young women were more likely than boys and younger men to have coenzyme Q10 deficiencies at baseline. Boys and young men were more likely to have vitamin D deficiency. It was also unclear whether they were folate deficiencies. For what reasons, I don't know. Patients with chronic migraines were more likely to have coenzyme Q10 and riboflavin deficiencies than those with episodic migraines. This is information that may help, so if someone has chronic migraines or whatever it is, talk to your medical professional. Look possibly about adding some CoQ10, riboflavin, and vitamin D. Those are the top 3 health headlines of the past 7 days. I regret I couldn't go into some of them in a little bit more detail, but I try to keep this all under 3 minutes. Thank you very much for listening once again, and I hope to see you all next week. Thank you.